All right. Good evening, everyone. I'd like to welcome everybody to the Town of Southbridge Board of Health meeting. Today is Thursday, January 9th, 2025, 6 p.m., Rice Conference Room. Relative to Mass General Law, Chapter 38, Section 20F, and for the benefit of the public, this meeting is being recorded both video and audio methods. Roll call, please.
Gus Steves.
Here.
Roland Larishall.
Present.
Kevin Swain.
Present.
Gil Provost.
Present.
Jasmine Canonis.
Absent for now, happened already.
Okay.
All right. The minutes went out, so consider and accept the minutes. Motion. December 12th, 2024. Motion by Kevin, second by Gus. Any questions, comments, concerns? I mean, Gil. Sorry. Looks like I'm old, that was a senior moment. Comments, concerns? Anything? Okay, all those in favor?
Abstain.
We knew that. 3 in favor, 1 abstain. Okay, I'll entertain citizens forum. I just want to remind that a couple meetings ago, in the last meeting, citizens forum is where citizens have the opportunity to present information or to address issues to the board that are not on the agenda. Each speaker will have 5 minutes to present the subject of his or her concern. The time limit may be only extended by a majority vote of the board for an additional 2 minutes. Each speaker will have 1 opportunity to speak at citizens forum, which I don't think that pertains because we don't have many. Same thing for the agenda items. Each speaker shall have 3 minutes on the agenda, and it can be extended by 2 minutes, and each speaker will have 1 opportunity to speak. So do I have anybody on the citizens forum that would like to take on anything that is not on the agenda?
Possibly.
Possibly what?
Okay.
That's a
So,
loaded question.
I have an issue.
Name and address.
Stanley Kowinski, Southbridge, Massachusetts. I'm speaking in behalf of my elderly uncle who is a resident of Southbridge. And I'm power of attorney for him as well. He's currently confined to a resident facility out of town.
Okay, what is your uncle's address?
Well, it's on
Well,
file.
first of all,
Can I make a motion that
we have to have a motion to allow you to.
Yes.
allow Mr. Johnson to speak since he's a Sturbridge resident, even though he's speaking?
Yeah, but I'm power of attorney for my uncle, and I have a document here that I can.
Nope, that's fine, we just,
Power of attorney allows me to
that's
speak
fine,
on
we
his
just have to take the vote.
Okay.
Motion by Kevin,
Sorry.
all in favor? Okay, thank you.
I prefer at this time, his residence address is on file with the Board of Health, Solid Waste Management, which I put an application in to opt out of the trash pickup. I don't like to give it out in public because currently his house is abandoned. And for obvious reasons, I hope, and I can supply it to you individually or as the board, but I opt to not do that.
You mean the house is vacant, not abandoned?
It's
That's two
well,
different.
right. He's still paying his taxes, I'm sorry.
Well,
He's still paying his taxes.
and you have control over it.
Correct.
Abandoned is a whole
Yeah,
different animal.
okay.
Thank you.
So what's happening here is on December 26th, I went to the solid waste office and talked to them about what do I have to do to opt out of his trash pickup. $115 per quarter, as you know. Is a 93-year-old gentleman who has the smallest trash I've never seen. I don't even know how to pick the stuff. It's a small little thing, 1 bag a week. And I know this because I assist him with pretty much everything he does. So I talked to, when I first walked in, there was a young gentleman there, nice gentleman, and he said, you have to get a copy, before you can opt out, you have to get a copy of the contract for your house, your number of your house. So the Wizard of Oz asked the request. I went away, I called Casella, and I said, I need a copy of my contract to opt out of the waste management. He goes, we don't have, Casella says, we don't have contracts. I was a little confused by the process, so therefore, I called back, left another message. Later on, Marissa Santos called me back and she says, no, we need to know who your new supplier contract's gonna be with for waste. I said, well, let me explain the situation. He left the home, he's in assisted divisional thing. So she says, well, we can't either deny or accept that he's there or not, so therefore you will be charged. So I'm like, well, charged for what? There's zero waste. He's contributing zero to this. So at which point, I went on the website, and it's very capricious and arbitrary as to how you can get out of this contract. She's basically telling me that we can't. And as you all know, when you're dealing with elderly relatives, you have lawyers, it could take a year. If he dies through this process, now you've got probate. We could be in this for a long time. So I am really looking for information, and it doesn't have to be supplied now, at least through official, offices and letters or whatever. How? Oh, by the way, and I did send a registered letter dated 12/26 to opt out of this, effective January 1st. So it's my opinion. So for example, I called the electric company, cable TV. They say, okay, you're gonna be, retro back to this date, okay? There's a bunch of things, cable, what do you have, internet, and they all go back. And what the waste management fund is telling me is no, there's none of that, and you have to pay forever. So I don't know what the process is to opt out of this situation.
Can you leave me, because we're not supposed to have a back and forth at Citizens Forum, but can you leave me, and if you don't have a piece of paper, I'll give you one on that, your contact information?
Correct.
And then we can either sit down for a coffee and have a conversation, or we can have a conversation over the phone.
Yeah.
And hopefully I can give you some options on what the solid waste bylaw states. Because we have to protect the community, and we have to protect you in this process. Yeah. And a lot of people seem to be making the process more difficult than it is. Okay. How's that? But there is ways to
Well,
get
I
out.
wouldn't be here if the process was presented to me in an easy, simplistic manner. I wouldn't be here. And it was so complicated. I mean, they said, oh, check the website because it's going to be around the 20th of February that you can opt out. And I said, no, I want to opt out now. I don't want to wait till whatever this date was that I was being told.
There's still a lot of confusion, missing information going out. So hopefully,
And on this, if this stays within your department, I'll write his address on here as well.
yeah,
Acceptable?
yeah, I'll take that for me.
Okay.
And then as the chair, I'll get back to you.
Yeah.
And see if we can come up with a
And
understanding.
I wasn't writing names down, but what was your name, please?
Roland LaRochelle, I'm the chair. I can have
Oh,
you
by the
removed.
way, just for your information, for no other reason, I was born and raised in Southbridge. I was born in 1952, was raised here. I graduated in Southbridge High School in 1971. Not Scott, Jimmy Lazo was my quarterback, undefeated in 1971. God bless his soul.
And he made a hell of a meal when he got behind the stove. Okay, we'll take care of that.
Yes, I appreciate it. I'm
Okay.
done. Thank you.
No problem. Anybody else on the Citizens Forum? Going once, going twice, 3 times? Okay, we'll move on. There are no presentations this evening. Item number 6. There's an informational report from Mr. Steve Gregoire, the Water Supply Manager, of upcoming. He wants to inform us, and the public will be subsequently informed, of a system maintenance to be conducted late January, early February of 2025, and for the board to take any actions if they feel they need to.
Thank you, everybody.
Thank you for coming. Okay, number 7. Want to play?
I will attempt to give you the simple version, and then you can ask as many complex questions as you like. As we all know, the Southbridge Water Department and water distribution system uses chloramines as a secondary disinfectant. Very successfully, I'll add. We do this because chloramines produces many less carcinogens compared to free chlorine that we used to use. And while chloramines is very effective at what it does, from time to time you have to do what can best be described as a maintenance cycle, where you actually revert back to free chlorine for a certain amount of time. We do this because the system appears to be, and by our testing, appears to be having what we call, or what the industry calls, nitrification. The simple version of making chloramines is we use chlorine to disinfect the water. We introduce ammonia, combine them within the water to make chloramines. And over time, your system can begin to break down the ammonia in the far reaches of your system. So the ammonia is a nitrogen compound. So that reaction creates nitrites and nitrates at trace levels. We're beginning to see some nitrates and nitrates at the far outskirts of our system. When I say that, I'll let everybody know when I say trace, they're just above the detection level of the equipment that they use to test for it. So it's practically non-existent, but it's not a non-detect. And that is one of the parameters that we have on our checklist to say you could be having nitrification. We've had a slight change in pH in our system. Now, these are all during the summertime. Currently, there's no nitrification. There's no issues. Cool water is very easy to work with. Summertime water is more reactive. So during the summer, what we normally see is very stable chlorine, and your pH in the system, we leave our filter plan just above 7, just above neutral, and it'll tend to trend up the scale more to more base. It'll go up into the 8 range in pH. And what we've seen recently is in some of the outskirts, we're not having a stable chlorine residual. We're having trouble keeping the residuals up. We're seeing the pHs not climb as they normally would have, and we're seeing those trace amounts of nitrates and nitrites. Those are all on the standard checklist for nitrification. So the maintenance cycle is to switch back to free chlorine for a certain period of time, which basically, for lack of a better analogy, sweeps out the system and kind of resets it. We would do this procedure for about 2 weeks. Once we see the entire system convert back to, the term is free chlorine, so regular chlorine. We would stay at that level for 2 weeks, and then we would just convert back like we did in 2012, and we're back on chloramines, and the maintenance cycle is over. So in the 12 years since we've switched, this is the first time we've really seen this. So once in 12 years is really good. It means that we're doing proper turnover of our water system. It's generally a healthy, good running system. This is just one of the things you have to do once in a while when you run on chloramines. I bring it to the board because the board is the one that really has a say in what we do with the water, not the final say. DEP is our controlling body. I do have to do some public notification, but because we planned on doing this work at either the end of this month or the beginning of February, I didn't want to miss a meeting cycle with you folks because you meet once a month. By doing it in the winter, you should almost see no effect in town. There really should be no odor issues. We did this in the middle of summer. The whole time it would smell like the YMCA swimming pool. It'd be bad. By doing it now, it's an excellent time to do it. We expect it to be probably in the beginning of February, and last a few weeks. And then we would convert back and everything would be happy. That's the really simple version of it. I would encourage as many simple or complex questions as you would like to ask. If there are any, if not, you can always email me and I'll be happy to answer them later, come up with something later.
Can we get a full report written? Statement?
Yeah, I'm gonna put a public notice out.
Excellent.
That's a couple of good things. First off, will citizens taste or smell?
They might smell a little bit of chlorine like we used to pre-2012. It was never really an issue in the winter, so I expect it to be very similar to a typical winter pre-2012.
Are you expecting, how is this affected by, or does it affect the treatment system that you're, changes that you're doing over?
We're very lucky in the way we do it. Give you an example. Boston, 400 million gallons of water a day go to Metro Boston, and it's all chlorines. So when they ship water out the door, it's all chlorines. If one of those towns wants to do what we're doing, they have to do what's called a free burn. They have to introduce massive amounts of chlorine to effectively strip the ammonia and the nitrogen out of the water. And it's a pretty aggressive process. You will get taste and odor. It's nasty. Because they're receiving water that's chlorinated.
Yeah.
Our water at the Brecknick tank is free chlorine. We introduce the ammonia on the way out the door as it enters the distribution system. We're simply going to turn it off.
Okay.
So we won't be doing a free burn the way it's described at the industry level.
Mm-hmm.
We're very lucky in the way our town is set up. We're just going to convert back out of chlorines and convert back to them. It'll be a very simplistic process. We may increase the chlorine residual. Right now we run at about 2 parts per million leaking the plant, which is very low. I don't expect that we'll go up at all. Only thing really we'll do is reactivate the chlorine booster that used to feed Charlton when we were on free chlorine. We will reactivate that booster to make the free chlorine last all the way out to Charlton because they're so far out.
Yeah.
We were able to turn off that system when the chloramines because it lasts so well.
Okay. That's good.
So the effects will be minimal, and it won't be any different than what we did pre-2012. It'll be turning back the clock.
And what happens to the nitrates and nitrates when they get stripped out of the system? Where do they go?
They'll get consumed and or like they do now. Like the trace elements of nitrates and nitrates that are in the water, people are consuming it right now.
Yeah.
The MCL, for instance, for nitrate is 10. We're at 0.02. Even so, we're that way down here, and they're just people will consume it as the water turns over. It will be gone. So there'll be no more ammonia or nitrogen in the system. We'll have free chlorine. There'll be no nitrates. They'll go away as people turn the water over from normal consumption.
Okay. And does either of these processes have any physical effects on the pumps or the pipeline?
No, it'll be literally like we turn the clock back 12 years, and it'll be just like Southbridge was in 2011. So if you do read about this, you're going to read everything that says a free burn. We're not doing a burn because we're not hyperdosing the chlorine to burn the ammonia out. So now if you see that, we're not doing a free burn. We're doing a free conversion. We're very lucky. We're probably the 1% of systems that can do it that way.
How much chlorine are you talking about?
If we were to burn it,
No, what you're going to
oh, nothing. We're going to leave the normal, the settings will stay normal.
Just eliminating the ammonia
Right.
and let the chlorine do
If you were to do a free burn, you'd probably be dosing it at 10 to 20 parts per million.
That's good.
Because what happens is if you add more chlorine and your ratio of ammonia to chlorine goes above 5, you keep adding chlorine and the residual actually goes down to 0.
Yeah.
That's called a break point.
Yeah.
And then it comes back up on the other side of the curve as free chlorine. And it takes a tremendous amount of chlorine to do that. We're super lucky we don't have to do that here.
You good?
I don't know nothing about this.
You're right. Gil? I'm sorry.
I do. When you start doing this, how long is it going to take to do this?
I anticipate the water age at Southbridge is about 7 days. So it'll take 7 days for the chloramines to leave the system. And then you generally run in that state of total conversion back to free chlorine, they suggest 2 weeks as a maintenance cycle.
Oh,
So I'm suggesting no more than a month.
Okay.
Is there a taste inhibitor to all this? Like, is there gonna be complaints now if like things taste weird or?
It'll be like it used to be back in the day. It's just straight chlorinated water. Some people will say it smells chlorine. When we went to chloramines, it actually don't smell any chlorine, which is nice in some regard. Some people like the smell of chlorine because it's reassuring. The water's chlorinated. Some people didn't like it because it smells like chlorine. When you went to chloramines, you don't get any taste and odor of chlorine, so it's good. Some people may now say, oh, it smells chlorine a little bit because it's free chlorine. If you walk into the water plant right now, which I implore any of you to do, you smell chlorine, you know, and it would be like that. And that's normally a summertime thing. I don't expect it at all being the water temperature being 40 degrees or 38 degrees. I expect it to be very low complaints.
But they're gonna be putting out subsequent information to the public so that they will have a pre-warning.
Yeah, there'll be a press release. I'm sure it'll be on the town website.
So people aren't yelling at us and they say it's a big funny.
Pretty much.
I mean, I'm sure.
But they yell at us. Okay.
So, good.
You-
Oh, yeah, one more quick question. Are there any particular parts of the public that should be maybe a little more concerned about it because of free chlorine as opposed to what we're doing?
The bigger concern was when we went to chloramines. So people with dialysis,
Yeah.
or if you were in a community with a dialysis center, they're more sensitive to chloramines. They have to use an RO filter to strip that out. Free chlorine, there's none of those concerns. So we actually, quote unquote, added concerns by going to chloramines.
Okay.
We're going back to the more conventional way of operating a water system.
So is it possible that some people may see a concern when it goes back to being chlorine?
It'll just go back to the way it was. The conversion itself isn't harmful.
Okay.
So that during that conversion phase, going back and forth, there's no harm to the public.
Okay.
So it would be just like we are today.
Is it possible anybody at the hospital might see an issue?
They're going to be on our notification list. They'll get ahead of time. We have a standard list of like 15 or so critical accounts that get notified.
Is there anything to stored water? Like if people during this time like storing water and like for like a couple of months, does it do like any of the enzymes or anything like revert to or create anything? Are there any interactions with that?
If someone were to, I don't recommend anybody store water.
Yeah.
Because the longer it sits of any type of
course,
disinfectant,
yeah.
the disinfectant will naturally come out of the water. And at that point, you get just water.
Yeah.
Anything can happen at that point. But during this phase, we're never not going to be disinfected. The water will always be safe.
And if I believe from our conversation, in the chloramines, the ammonia was the additive. So that it got out to the furthest reaches where chlorine as a heavier element dropped off. So you got more of a distance. So now you're taking one corrosive and cleaning the other corrosive, basically taking out the nitrogen compounds so that it's like doing a normal reboot of a computer versus a crash.
And like for instance, one of the areas that we were seeing lower than normal residuals was the Lebanon Hill area, trailside area, and we were faced with two possible solutions. Is the low residuals being caused by nitrification? We believe so. If it's not being caused by nitrification, then it is being caused by the actual water main itself, which is a cast iron water main. It could be being reactive and using oxidation to strip the chlorine out. The answer to that would be to do a cleaning and lining project where we take the main offline, put everybody on a temporary bypass, line the main with cement. It's a really interesting process, actually.
Polymerization, right?
What's that?
Form of polymerization.
Sort of. And then this is a cost of, I gotta say, at least $500,000. So by doing the simple maintenance cycle, we're either going to check the box that we do need to do it or don't need to do it.
Right.
Instead of wasting $500,000 to find out we still need to do a conversion to free chlorine, we're gonna do it ahead of time. And then if we still see a problem, we have plenty of time to budget and do that work.
I was curious, does that, does that line run right up the street from Tressa, or does it cut through?
No, it goes straight up Lebanon takes a left on the trail side, goes into the pump station.
Because I was curious about that because the condition of trailside before they paved it was in pretty tough shape. It hasn't fallen in on itself. Could that have done some damage to the pipeline?
No, because we don't have a leak. It's a pressurized main, so you'd be bubbling up.
Okay, that's good.
That's the nice part about pressurized water versus the unpressurized dirty side of the industry.
Good point. Okay, anything else? All right. We'll be looking for what you have coming out for the people.
Yeah, it'll be a very simple public notice. It'll be easy to understand. We're just encouraging people to call if they have questions. I won't go too far what people say. There's a recommended service now that DP supplied me with, and you just adjust it to fit your needs.
Okay.
So would they call you or call us?
They can do either. I suggest they call me.
He's the SME.
That makes sense.
His place is the SME, and he could know how to talk to people
Exactly. So,
here or here.
Anybody?
Otherwise, we'll give him his home phone.
I implore any of you know if you have any questions after tonight, just shoot me an email, and I'll get you the best answer I can.
What's your contacts on the website?
Plus my contacts on the website. Luckily, not my cell phone. Yes, I know you have.
All right, thank you. All right,
Thank you all.
okay.
See you.
All right, number 6 is done. Number 7 goes away because I have a email from Tracy. Like I said, they have averted the longshoreman strike. They come to a tentative agreement. So these things can be shipped. So she sees no need to use the food building at this time because it was only precautionary should the longshoreman go on strike. Then it would be a storm. That being said, like I said, I have an email from her that we'll put it on the agenda and I'll send out the information that she's discussing for the February meeting on how to come up with a nice, simple plan of notification to us, health department, building department, should they request the use of that building for storage in the future, instead of coming to a meeting and getting involved in all this other stuff. But this will be, I've got several different things. 4 reasons, 6 ways of notification that she put out as some information to chew on before the next meeting, and she'll be here. And then we can come to an agreement, or if the board wishes that she comes to every meeting every time they want to do it, so be it.
The blue building, is that ours or theirs?
That's theirs. But it falls under the site assignment, so it comes under our role.
Yeah.
And that's the reason. Okay, so 7 is gone. Number 8 is gone because Joan is ill. So we go to Dan's report, and unfortunately, Dan, I left A in there, so I don't forget, this is senior moment. But there should be no triple E or anything else when it's 12 degrees out. Because otherwise, there's one mosquito that I don't want to get introduced with.
Thank you, Chair. We'll proceed to B, COVID and infectious/contagious diseases. I would say, I would ask, first of all, you have the report from Senator. So most notable is the incidence of influenza.
Yeah.
It's either 27. That's increased over a 2-3 month span. In October, there was just 2 cases. In respect to COVID, the confirmed levels have increased from November to December. There has been an uptick. And in November, we had 25 confirmed cases. And in December, we have 44. Moving along, tuberculosis. This is quite a contagious infection. We know it's caused by a bacteria. It mainly affects the lungs. The challenges there always present a lot of trouble for the health departments, mainly public health nurse, because of the trouble with diagnosis, treatment, and certainly prevention. It entails a lot of work. Again, a public health, a lot of work.
So is that,
So that-
are these people in quarantine? remember the case in Washington.
And,
where
and,
somebody-
and, the- and the treatment process can be cumbersome.
Yeah.
And it's and very time consuming. So that's what it is, and it's actually day to day, so, unfortunately, 2 cases. And that is my update with infectious diseases.
Are any of the influenza cases virtual? Are any of the influenza cases the virtual?
Recorded right now, bird flu, 66, 70 cases nationally, with 1 fatality. Two boards of health and other departments, unfortunately.
Remember that thing? Remember the boys club thing?
Yes. Yes. Fortunately, it can also happen again. There's other cases, especially when we speak of that agent, that epidemiologic agent, listeria. Virus listeria.
Yep.
With the food safety, it's been more prevalent than unfortunate. Okay. Moving forward, we'll do a blight update. I have 3 locations. One of which is 743 Main Street. Unfortunately, right now, we're having difficulty with legal ownership in the process of making service. This has been transferred to Attorney Caprera in
743?
743 Main Street.
Big one across from all
Yeah, the 2 large ones. It's the gray one up on the hill.
Oh, yeah.
Yeah.
We started cutting all the trees.
Yeah. Previously owned by a Shirley LeBlanc.
Yeah, that's
So we have been trying to make service and contact the individuals. Presume that the property is an estate, Quincy, Mass. Attorney Caprera's research has revealed that the estate is not listed in the Worcester probate. And in order to proceed further in court, services required for the receivership or any demolition or any enforcement enactment. And right now, as we put it in court, we're trying to petition the court in order to have violations addressed and corrected, uphold the state sanitary code. Again, just to reiterate, the difficulty is with ownership, legal ownership. This has presumably been a challenge and a difficulty for the health department for many, many years. Coupled with the fact that the property is deficient in paying taxes, sewer bills, and we can use the word abandoned. So what I just want to tell the board members is it is in the hands of the attorney trying to proceed through the court process. But the risks are imminent there and they continue to grow. My last visit there, I was able to verify that there's human excrement, dumping, continued entry into the building. It is not secure. The status of the building and the infrastructure, how compromised it is, would be in the hands of the building department. But I can honestly say it is in many areas it does look weak. It is becoming again a dumping ground, so we need to address it ASAP. And again, unfortunately, this has been a problem for a long time. And it underscores the point that something has to be done. Now we've outlined a game plan. It's just getting there and finding out where this individual is. And the fact of the matter is we still do not know if the individual, Shirley LeBlanc, last name owner, is still alive.
Where the truck was. Yeah, some-
Can I ask,
Yes.
can I ask something on past? I know the building commissioner got a hold of someone because the garage was breached and the weeds and other debris was high. And he gave somebody an order to board up the garage and cut that stuff down within 2 inches so that you could see if there was any openings in the house.
I believe, Chair, that I think, are you referring to the location next to it?
I thought it was this
Yep.
one on the corner of Sales.
This one is on that junction, yes.
It's the wooden one, beige one on the corner of
Beige
Sales.
one, yes, it is, yes.
It has the L garage on Ash,
Yes,
that the garage doors face Sales. And then I believe there was a question on somebody parking a truck on the
That's
front.
it.
there is a truck, yes,
Yeah.
yes.
So, I believe Mr. Tatro got a hold of somebody to get rid of that truck and board up the garage, and we're gonna do it, and he's gonna,
That has not happened as of yet.
okay.
So
So
it's an
here's
inspection
my,
conducted last week to affirm if there was any movement, whether any cleaning. The truck was still there, the tires were still there. There's clear and concise evidence of homeless individuals camped out in the side yard. That's where we're finding a large amount of trash, garbage, debris, and coupled with human excrement. Okay.
in a hospital porta potty.
That's correct. That's correct. So this is a concern now taking into account that we have also witnessed activity inside. Movement. Reluctant to go inside, but we do know. And I can tell you every time I go there, I see further evidence of activity inside. But there's another window that was boarded up. So there is. So this does pose quite a challenge for us, and in fact, it's going to be just a waiting game. I hate to use that, but we have to do our research and our due diligence in order to move on that.
Well, I agree, for the legal end, it's a waiting game. Long term. Short term, it's a vacant building with no utilities. The unfortunate thing in the town of Southbridge is we are lacking the facilities for homeless. It's in the single digits at night now. In my opinion, I'm sorry I didn't let the board go first, but we've been talking about this for a long time, and I don't know who we have to get with. Whether we get with the building, whether we get with the building commissioner, the fire chief. What's gonna happen is we're gonna end up with a disaster with the homeless in there, especially when there's immediate, it's unsafe for them, it's unsafe for the neighborhood. God help them and us if somebody lights a fire in there to keep them warm,
Yeah.
and it takes the block.
They start like
Great,
an indoor
great.
fire, yeah. of course.
That is something very near and dear to me, but this is a small scale versus the Worcester 6, because I was friends with a couple of them. And that was the same thing, except I think our thing to get, whether we task DPW in the time, and we've done it before in this town, the time and the materials are put on the tax. But when you look at the risk benefit, to secure that, and again, police in there, because somebody's gonna have to go in and make sure nobody's in there, because God help us if we lock them in. But secure the damn building, and it's for everybody's benefit. And hopefully, because I was told that the other day, that a homeless guy lives on the front porch. And
It's
if, you know, we're having these things in, you know, my heart bleeds for these people, we should have something in this town, which is a whole another discussion. But at this point, it's a vacant, unsecured, dangerous building. You said yourself that you looked at the structure itself as compromised. Human nature, and my wife talked to the gentleman. The gentleman was very nice and said, and asked him prior to this cold snap, and he said some people are nice enough to leave their front porch open. You know what? If it's your house and you want to leave the front porch open, you're assisting this person. And he said, just make sure you change your socks and wear a hat, because if you go to bed with wet socks, you're in trouble. This is what the guy told my wife. This is a shame. It's 2025. We should be helping these people. Point being that going into a building like this that's already compromised, you have a compromised person, compromised building. I don't know what it takes. Let me know how I can help, and the board can help. But I think that should be cleaned out as far as people and strenuously secured. And worst case scenario, if, and we've done this before where people beat around the bush and nobody knows who owns it. Attach taxes, and there's the avenue on not putting a lien on the building but adding this to the tax. And the town has taken these properties before. And to help out the neighborhood and help out these down and out individuals, if it comes to the point that the town has to spend grant money to tear it down, that is the last resort. We always want these buildings to be renovated, fixed, put back on the market, and go back on the tax rate. That's what we want. But if we have these people that are dragging their feet, and we all know, we've all been there and done that. The court system, they have boat anchors tied to their ankles on the speed that they move. That does not help us, it hurts us, and the poor individual that's, or it might be individuals. And this could be a tragedy waiting to happen.
It certainly is a precarious situation.
Yes, and we've had that on our table for months, at this discussion, so nobody can turn a blind eye. And I got enough nightmares when I go to sleep at night. I don't need another one. It's,
Well, when we put those cameras, those little things like we were gonna put for the dumping.
those are already in place, but we don't need the cameras because you can drive by there during the day and see it. It's visual, it's not, we're gonna catch you. No,
Yeah, no, we already know that.
you know, we already know what's going on.
Yeah.
And as far as the truck, it's up to the person. I don't know how big the truck is. If
It's pretty good
if
size.
it's,
It's like a box truck.
okay, so that might violate, it might violate the bylaw that you're not supposed to put a commercial vehicle.
That is correct.
So therefore, that avenue might be to have Shane run the plates. And do you have permission? Otherwise, it's trespassing. And then if it's violating the bylaw, hook it. That's the only way they learn sometimes.
I agree with the truck. I brought that up, I think, at the last meeting. I noticed that truck was there. It's still there now. I do agree. Maybe
Does it
that's
ever move?
something-
No,
No.
Yes, it does.
I haven't seen it
yeah, I
when
haven't
I
seen
drive
it,
by. I usually
yeah.
go by early in the morning, but yeah, I agree. Shane should check into it.
Because if it's
He can do
abandoned,
something
that's
to
all
help.
different.
It
No,
has
it's
moved. I've been there before where it's not.
Okay, so at that
It's a
point.
fairly new vehicle.
Oh, yeah, it is. It's a nice, it's a real nice vehicle, but I think if Shane can, run plate, find the owner and say, hey, bylaw wise, you can't do that. The other thing I'd like to know, to piggyback on what you were saying, and I agree with you as far as it should be, that building needs to be secured, whether, it's a highway department or whatever. But my other thing is, legal wise, can we, I don't know if we've done it yet, but can we condemn that building and post it, no trespassing? And
But that is an avenue we can take.
to protect us with it being posted?
We can. Yeah, we can legally do that. again, we have a profound interest in making sure that the endangerment of public safety
Right.
is mitigated. And I certainly feel it starts with security.
So would that be,
Well,
to secure it, would that be condemning
they-
it and then boarding it up?
That is something that I talked to the commissioner, the building commissioner, about. Actually, today we were going to make a visit, but we've had to make changes and reschedule that for next week. So it's gonna be a concerted effort.
Because myself, the way I'm looking at it is, we've been talking about this property for some time now, and I just don't wanna fall back and I don't want a repeat of Brick Road.
What I can answer to your question are, as we condemn it, we may not see results due to these legal issues. But legally speaking, if the health department condemns a building, any type of building, and if the violations are not corrected in the threat of endangerment, threat to public safety and health, still exists after a year, the board can have the building demolished.
Well,
And a nuisance removed by that process.
and I understand that, and I agree with that, but I'm more concerned about
Short term.
tomorrow morning. What can we do immediately to secure that property, stop the people from getting in there, whether it's condemn it, board it up?
In my honest opinion,
Because that is a major,
yes,
major.
yes, agreed. In my honest opinion, it would necessitate boarding it up, a move in which the equipment, the supplies, and the labor is done through the town, and then leaned against the property. Okay? Taxes, should have talked about it, and the building commissioner talked about that as well. Having these, again, procedures enacted in the town to eliminate the risk. And then move forward after that. So agreed.
Basically what, I don't know,
I think-
how any other way to say it, but I want this boarded up by the end of next week, so if you gotta meet yourself, the town manager, the commissioner, is it feasible to have that building secured by next week? Because,
By next week, I can't answer.
you know, meet with the DPW,
By the
can,
end of next week,
Can-
because
yeah.
today's Thursday.
can,
Next week is,
what I'm saying is can we have a meeting with all these department heads to get the, even if it's not together, but one here, one there, to say, hey, this is what we need
Sure.
to do? Do you have the manpower?
Start rolling things along.
because here's,
I want to, because that building is, I'm very afraid of that building, as soon as it
Sure.
hit
here's another thing with that building, we've been talking about it for a long time.
Yes, we have.
The lack of facilities, there's no power, there's no toilets, it's vivid. People have got that potty chair outside and going next to the building. It's sad.
Yes, it is.
One question. Different owner, I looked it up, the building next door. The brick one.
Yes, different.
Is that secure?
Yes.
Okay. My thing is they're getting all the agencies together because one thing, and I raised hell way back prior to you with Brick Row, when there was stairways missing and all this other stuff.
Yeah.
Why the hell doesn't the fire department know and have a mark put on that building? Because if that building catches fire, the only way that the fire department knows that it's vacant is that they go in and look. They have no pre-warning. So if there is if you condemn the building by the health, right then and there when that paper goes up, nobody's supposed to occupy it, correct?
Correct.
It gets condemned by the building because of structural defects. Working with the fire department to put a slash on that building, telling the fire department that there are building defects. And X means don't go in. The slash means there's defects in the building, use all caution. Well, like you said, public safety is also safety of all our employees. And that includes police and fire, should somebody call and say, I see flashlights. the police should know, and they're also well aware, and it used to be, what the slash mark and X means. But that's one building that's been haunting us for years. And especially now with all the evidence we have, I again would like to see action that next week. If that big colored thing is on the building, to condemn it. Go down there with all our different SMEs, clear the building, and plywood the hell out of it and secure it properly. Because if somebody can go there and just pull plywood off the window, that was put up by the guy that, works down in Florida with the big ears, okay? It wasn't done properly.
You are right.
It wasn't done properly.
Very flimsy.
Because I don't know of a person that a homeless person that has a screw gun.
What I can tell you is by next week from my part, for my part, I will enact the condemnation. I will speak with building, fire, but mostly with building,
Start with Teddy, yes.
yes.
Teddy, right.
This is not going to be unprecedented. This has been going on in review of the records that I have since 2016.
Way before you.
And I agree, it is time to, Kevin said, to do something because of the severity of the issue.
The amount of homeless in this town, it's,
Scary.
that's a scary part. And, the big thing, like, the X on the building is huge.
Well, that's gonna be a
That-
determination of what the fire department deems at an X or a slash,
Right.
one or the other. And that's their jurisdiction.
That's right, that's right.
Because, it's a shame, and we understand fully the legal process, but we've got to do something as a community in advance of that to get it done ASAP, to make it safe ASAP.
I will make it a
The
point.
legal crowd, that's why the lawyers make a lot more money than we do.
That's a follow-up question. So what are we gonna do with the people who are staying in them? Where are they going? Because if they're being kicked out of the
I
building,
do
they
not-
can find some other vacant building to go into. Does the town own any buildings that are halfway in decent condition? We can put them in temporary.
I cannot
No.
answer that.
I do not. This
What
discussion,
good is having a building that we have that we can't use that's just.
I don't think the
I
town,
think the town owns any
I don't think,
buildings, just
number
lets them all off.
one, I don't think the town owns a building that'll do that.
Maybe not.
Number one. Number two, there has been talk about a homeless task force.
Yeah.
That takes money.
Yeah.
We lost that. There is also an issue with, if I'm not mistaken, the zoning. Because zoning in this town does not allow a shelter anywhere in the boundaries of this town, believe it or not. Okay? So when you have places like the doctor's place on Main Street, temporary.
Yeah, and it's
When
private.
you use, and that's private. So when you have these when you use the word temporary, that's no different than the town opens up the armory because it was a disaster, it's temporary, it's not part of zoning. We don't have, it's a shame, but we don't have any resources in town to do this. Right
We'll
now,
certainly see if we can address it, but the other measures just have such a consequential effect that.
yes,
No, I get that, I get that.
we need to do something now for their safety, okay? And if we have somebody that opens up their porch, thank you, you're going to heaven. Okay, because you're helping him. In the meantime, we know there's homeless, and this is just more facts that we can put on the table. And we have to do it right, because even opening a temporary shelter, if you do it by the rules, is enormous. And we don't have to have a disaster like California, but the responsibilities on the town is enormous. So, right now, we have no other avenue but to make sure these people are safe and that place is not safe.
Unfortunately, outside of freezing weather isn't safe.
And can you also reach out to the Police chief, please, in regards to that.
We go to the truck. Yeah, get that.
There might be somebody across the street.
We
Might be a name.
That's what I'm thinking, but he can run the plate and.
Sure.
And go that in and maybe use the town bylaw.
It was a town law, that's
You know,
enforced by
right.
the building department.
Yeah.
So.
Oh, is it?
Yeah.
Okay,
Defense
perfect.
vehicles. I'll speak with Ted and Mike about that.
Yeah, Shane can run it and feed him the information.
Sure. Moving forward, the other two locations that I would like to address, 19 Crestwood Drive, 131 Dennison Crossroad. The Assistant Attorney General of the Neighborhood Renewal Division will be getting demand letters out. This is part of the receivership process, so there is movement on that end with those two locations.
And those are secure.
Yes, dear.
Perfect. That's all we can ask. And I can't think of, they're still working on the Vienna. They're still working on Main and Pleasant. I can't think of any other vacancies off the top of my head.
Has there been any movement on the mill?
Yes, I'm gonna bring that up and.
Has there been any
later on,
movement on the mill?
I'm gonna bring that up
Not that
Okay. So that takes care of C. Any other announcements?
I'll continue with the announcement.
Okay.
The health department is interested in developing anti-choke training, a clinic for food service establishments. We've recognized that many establishments here in the town are deficient of that certification and the proper training that is required by the food code. So we would like to conduct this in tandem with individuals that are trained and licensed, individuals or entities who have expertise in Heimlich maneuvers, first aid. So the anti-choking is just an abbreviated piece of.
Basic first aid.
Yeah, Heimlich. That is something that we'd like to move next month.
Okay.
We've discussed it, and we're seeking individuals and entities that have that expertise and can assist us.
Have you reached out across the street?
Somebody actually reached out to us.
Okay,
Yes.
because I'm sure they have some trained people. And the other thing is too, when this is advertised, the clientele looking for this for renewal on daycares, and so on, stuff like that, might want to get in on.
Yeah, the kid that came and talked to us said, like, we could do a big session here.
Yep.
And he would adjust the price according to how many people.
We're gonna have the big mustache, right?
Yes, he came through.
The non-thin guy. Okay.
Oh, no, he's good.
So which was very ironic because we were talking about this weeks before, and that gentleman did come in and continue, spurred the conversation further. So that is an endeavor that the health department will be looking into.
You'd be good.
Do you plan on reaching out to the businesses that would need this directly?
Yes.
How do you have a list of them?
Yes.
You might-
Well, so as our involvement entails is with food service locations that have 25 or more seats. Those are the ones that are mandated to have anti-choking, an individual that's certified in anti-choking at all times. Usually the case, it's not the back of the house staff, it's the front of the house, the servers part.
Right, makes sense, sure. What about the
So the establishments would, theory, need more than just one individual. So I have done this in past municipalities that I've worked with, and batching a group of these individuals through a clinic has proven advantageous. Multiple ones, because there's a lot of people, and the turnout has been really significant. One of the items that I have seen that has been a detriment to individuals getting this anti-choking is the cost and the availability. If we could keep this at a nominal rate through this individual, we'll will have a better turnout. That's really what we want. So it's a win-win for them.
Sure.
Previous amounts that I used to see were in the $100 range.
Oh,
If we get it down to 25, 30, maybe 40. Again, it would be with the individuals conducting the
like
training.
Roland said, people need the certification a lot of times.
Sure, and then there's many others that we do not regulate that would still need it for their own purpose, so.
Exactly.
Well, I'm
Some-
thinking like childcare facilities.
Yes,
You know,
yes, you're right,
kids-
you're right,
Well,
you're right,
like
you're
the
right,
children
you're
are
right,
persons.
you're right, right. So we'll keep the, board members
Have fun.
abreast of this, of the movement with that.
I'm gonna check with, I don't know if this is gonna fall into it, but let me check with the Public Health Emergency Preparedness Committee.
Sure.
Because I just got something today on putting in for, I think it's equipment, but I don't know if we can get any grants money for,
We may,
to
it'd be
offset.
worthwhile to just looking into
I
it.
gotta ask them on some other items that we might have for,
Yeah.
like the shelter and stuff like this.
Sure, sure.
What we can ask for.
Yeah.
But,
And that may very well, there's some fruit, but we're looking at a trainer, trainers in the area that would be willing to do this.
yeah.
We'll do
because-
the outreach to get people on and take it from
Because
there.
even if we can get some money on a grant somewhere to pay for the trainers, then it's only disposable supplies and stuff like this
Sure.
that they would have to charge the
Yeah.
individuals,
Do
which
that.
is chump change compared to.
And if not, it's usually the trainers will get the payment. We'll do the advertising, systematic coordination. It's a win-win. Okay? In regards to the flu clinic, I'd like to commend Patty for her hard work organizing and overseeing the clinic, the December clinic.
How many do we have? That's the only reason I left it on.
I had 22 signed up, I had 4 back out, and we ended up serving 35.
Nice,
Just walk-ins off the street.
perfect. Because I know the flu's around. And I know it's
It's all right.
that and
Those
norovirus.
numbers again, 22?
It's hitting.
Started with 22, 4 backed out, and we ended up with 35.
Good.
Those are good numbers. That's real good.
I mean,
Good job.
yeah, compared to the pharmacies offer at walk-in and everything like this, to have some more, you caught these people that fell through the holes.
Absolutely.
So that's perfect. Anything else, Dan?
I am all done, Chair. Thank you.
Okay. Now, on the solid waste, Maritza is aggravating all of us by being in a warm climate, but she did give me an announcement. If you haven't already got them in the mail, the 2025 recycling calendars have gone out. I received mine yesterday, and if anybody needs some, they have them in the office. She says all local regulations can be reviewed on the town website, including Code of Regulations, Chapter 2, Storage and Disposal of Solid Waste, and a bylaw to manage and control blighted properties. It's all on the website. Number 3, per solid waste regulations, all toters shall be removed from the curb no later than 12 hours following the collection. This has recently been an issue, and there's been some complaints because of wheelchair and pedestrian traffic of some of these places that you see have so many toters that it blocks the entire sidewalk. One point of interest, DPW will be picking up the Christmas trees through the month of January. Place the trees out on the curb, free of lights and ornaments and everything else.
Well, you could donate them to a farm for the.
Or you can donate them to a farm for the goats. But as well as that, you gotta be careful. They can chip some stuff, but when it goes out to the animals, no tinsel, no ornaments, no nothing, because you're gonna hurt the critters. Make sure they split, no spray, snow, none of that stuff. If you're looking to dispose of bulk, try to donate, upcycle, downcycle, or place in social media.
Yeah.
Placing a free sign is frowned upon. So, there's many avenues out there for donations. So there's been a lot of problems where people think if you put a free sign and you put a kitchen set out in your front lawn, that it covers you. By the blight bylaw, interior furnishings. The minute they go outside, especially when you see stuffed recliners, are now trash. Because they're gonna get moisture, the elements,
We've
and when
been,
you bring them into heated area, you got the automatic mold.
we've been burned on social media for that.
Oh, yeah.
I just left the ellipticals, leave it out in 2 seconds, the Board of Health will be like taking pictures.
I saw one out there that was on, social media, that they threw out a foldable walker and some other medical equipment on the curb, and I got it marked free. Are you kidding me? Just put it on Marketplace, because there's people who have their family members that just had a knee replaced or something like this,
And that's
that will
expensive.
go and pick it up. A walker is like $40.
It-
But for some people, that's too much
It's a lot of
money.
money, yeah.
But instead of having it go out to the metal guy when it's usable, is put it on Marketplace and these people will come and pick it up so it can go to be reused. During the month of February would be the next opportunity to opt out of the municipal curbside collection. Remember, it's 30 days before the cycle starts, because the process down the hallway on the billing cycle and the computer system and all this good stuff.
Where
You
are the
have to
trees
opt
again?
out.
Until when? What days on the trees?
The month of January,
So you just leave it out?
you're gonna put it out at the curb, undressed, and the DPW pick it up.
There's no date, though, you just leave it there. They'll-
Whenever your trash day is.
Yeah.
For the whole month.
That follows the trash day.
Okay.
It always has, yes. Okay, that's all I had from her. Nothing else on that. All right. I do have some documents that we have to vote on that I got earlier from Michelle today. First one, this is the FY25 third quarter billing. We need a motion to pay $627,785.
Motion.
Any questions? Seeing none? All in favor? Opposed? Unanimous of those. I have 3 others. There was an overbill. There was an overbill for $944 overbilling. So that will be a negative. So I will take a vote on that 944 to accept that commitment letter of a negative 944. Questions, comments, concerns?
No.
All in favor?
I need a motion.
It's all one.
Huh?
It's already done, it's all
Is
one.
it different ones though?
Well,
All under the same.
Okay.
Sorry.
And wrongfully charged. We have a total of $805. Let's make sure we do it right. Motion for that negative?
So,
Motion, second. Concerns, questions?
Yeah, wrong.
What?
It's not that, it's these two combined.
Right.
She said 1, 2, 3. It's not 805 because I think it's not 805, it's one of them wrongfully charged for $742, the other one wrongfully charged was for $857.
Gonna have to back her a little bit.
That's why she pointed 1, 2, 3, 4. Yeah, it equals.
What did I do?
Nah.
$15.99. All right, so I'll take a motion for wrongfully charged. The total is 2 different, she keeps everything. So there's 2 different for a total of $1,599.
Wait, fine, we already did it.
Yeah, it's just all.
I got the
All in
motion.
favor?
you gotta vote.
Any questions? No questions? All in favor? Opposed? Seeing none? Unanimous. Thank you very much. That moves on to that. Done. Okay, Chair and Members Forum. Josh, you were out last week, so I'll give you the benefit of the doubt before we shut you off. Nothing? No? Wow, it's a new year. Good year. Anything?
You're gonna be asking the stuff about the shelter and stuff with your, you said you were talking to that board.
No, I'm gonna talk to, see if there's any money
Yeah, so you already know.
that we can do something with the training and that type of stuff.
You already know.
Kevin?
Yes, with you saying it's a new year, I got some house cleaning that I'd like to address quite a few things, so it's gonna take some time. I'd like to know if I can get an update on some information. One, the Mill Street property, I know I believe it's called the Brownfield grant. We applied for it. We haven't heard anything in months on that. I wonder if we can get an update from whoever, where it stands, how it goes. I mean, that property is the biggest eyesore coming into this town, and it does not help with 743 and 757 right there. That into town looks horrendous. So I wonder if we can get an update on how that stands. The other thing I'd like to discuss at our last meeting, Dan stepped in for you and we discussed the South Street property with the gentleman trying to grow trees or something. We gave him a 2-week extension, which has come and gone. I'd like to know how he's dealing with that. I still have people.
A re-inspection that was conducted last week revealed that there has been some movement to comply. Some, not full. Another order to correct it has been issued. We will wait if the other piece is completed, the removal and cleaning.
Do we have any update on, we've talked about this previous a couple of times, we haven't discussed it lately, the Greenways Avenue property, which is behind the
That is, there is no update as of yet. That is troublesome again with the fact who the owner is, because it is in probate.
So we are still active on that one, okay.
Very similar to the estate in the situation here.
What's the condition, what's the present condition of that? Because that
There's cars in the,
Oh,
there's
all
junk
right.
in there,
There's a lot of vehicles.
So it's more of an exterior,
It is extreme
Trash.
accumulation, but he's right, the number of vehicles
yeah,
coupled with
That
other
follows
extraneous items from grills
Grills
to
to tires,
machinery,
to-
tires.
does anybody live in that house?
Yes, individuals that are associated with the previous owner, plus some.
Plus,
it's a tough thing, I just wanna,
Yes.
general public,
No.
cause I get a phone call from
Sure.
a neighbor, so I just, everyone my thing. The other thing I wanted to bring up is, you're probably gonna have to, it's probably the commissioner or the building inspector, but I've been getting questions, and I have it myself, in regards to the Union Street grocery fire.
Right.
Can we get a time definite when that pile is gonna get removed? Because I know people, and you could see it, they're breaching that fence wall. And when that building was taken down, that was taken down. So there are some people's personal valuables
Correct.
still in that
They're
pile.
all
The
mingled, obviously, in
the plastic that they covered it with,
there's not enough to charge.
I think our commissioner should reach out to the insurance company that did that demo, and they should be held as far as replastic and that again.
Sure.
Because the plastic, especially with the winds we've had the past couple of days, the plastic is.
That was supposed to be a temporary thing too, by
That's
the way.
where I'm kinda, I mean, the fire happened,
Yeah.
4 weeks ago, 6 weeks ago, I don't know what happened, it's some time, but I would like to get a time definite when that pile is gonna get removed. I don't know if there's some legal thing holding it up, if so, can we get that?
I think it's a
I cannot speak on behalf of the building department.
Right,
but
that's
there
why I
must be
think you might have to reach out to them.
reasons, so it is a discussion that I would have to have with the building department, which I will, just making notes.
I mean, that's another shame, even when they had the other fire, I witnessed it myself of somebody had crawled in a void. And there was a lady outside going, I think that's my chair.
That's the thing.
And that building was taken down hot because it was not, the asbestos wasn't taken out, the lead wasn't taken out, all the scrap is there. And that's what the plastic is for, to secure it. And
Can I follow up with that for a second? It's completely related, but it just made me think of it. Is there any way that we could have the authority to get the DPW to replace the plastic that's sitting on that giant PCB mound? Because that's got trees growing through it and all kinds of stuff.
Where?
As you enter,
Yeah, right.
That- right,
That big mound there that's covered in plastic that's full of PCBs.
Oh, you mean
That's
that
it. I believe that's a DEP.
It is,
I don't think the town can go on.
But can we at least get them to replastic it? Because it's got stuff going out of it.
That's hazardous, that's
It
hazardous.
is, I know it is. That's why
I
I'm
believe town workers cannot go on that.
whoever's responsible if that can be resealed, I think is what you're looking
That's what
for,
I'm looking
not
for.
specifically DPW.
Whoever needs to do it needs to get done. Like, can we like maybe at least send them a letter or something? Saying, this is really wonderful. We want this done like now. Before it gets leaching into everything again. That was the problem.
Another thing I wanna bring up, and I don't know how we can go about doing it, but with this time of year for me and what I do, I drive south, every single Southbridge road, like, at least once a week. And there are numerous properties in this town that the blight, I am appalled, and I don't blame neighbors for being upset. I have a couple addresses I can give. Is there a way that we can spend an hour a week, 2 hours a month, and just drive around every single road in this town? And just look at these I deliver oil in the wintertime in
Yes.
Southbridge, so I drive, that's how I see it, driving around and looking. Between seeing properties that have numerous cars and trash and scrap piles and you name it, tires. Let me tell you something, I'll give you the addresses off camera and you drive by there and you tell me if you live next door to it, if you would not be upset.
Do you know about these stuff?
That's what I'm saying, I'm asking if we can somehow set aside somebody to drive, like I said, an hour a week, 2 hours a month.
We should get a list together, because they
Can
might
I
already have
ask-
it.
But
Yeah.
no, not this.
No. Can I ask that you give a list of these addresses for Maritza when she comes in Monday? Because Tuesday? She's got two guys that travel to town.
Got some that are just sitting there that they haven't done anything yet.
Correct. These guys travel the pickup route.
Yeah.
But my question is,
And instead of reduplicating, they might already have the process in the works for some reason.
Right.
I guess my question would be, Ray, if I can, Ray. Ray, when you guys go out, are you looking for, like,
Everything.
Yeah,
to the
you're
point,
right.
like, abandoned vehicles, campers, abandoned, I shouldn't say abandoned, but just
Sitting there.
construction equipment and,
They look for trash as well as blood. I'll put it to you that way.
alright, so,
That is seen from the
A lot of
road.
these
Yes.
properties, the owners don't live in town.
Right.
In Bellingham, Boston, you send them letters, they don't accept them.
so when I see them, I'll just forward it.
And
I'll
this,
give you two
this
addresses
could
so you
be-
can look.
this could be already in the process, because if they'd ignored it, then the next step is the fines. They get 2 warning letters. So everything on Facebook, and I'll say it again, everything on Facebook, that warning that goes out is not a fine. You get 2 warnings. And there's a script that tells you exactly what they're looking at. If you ignore it, that's a violation of the blight bylaw, that's a violation of solid waste bylaw, and then it goes out to a 21D fine. After 2 warnings. Now,
I
if
can
they,
tell you though that we've had people coming in our office with their papers and it doesn't say what the problem is. It just says objects or debris. They're like, what are they talking about? So there are some people that don't know.
They
then
should have a picture too.
they
They bring
usually,
in a letter.
They should.
You send the picture on with it.
I have one. And here's one right here. Here's an example. And this is something that we have to let her know because it depends on what the script is. But they go out and they take a picture as a record keeping and information. This particular one, the dining chair, baby carriage, and other miscellaneous objects and items around the property. And it's usually associated with a picture. So there's a lot of good people I didn't know. That's my tenants. I've told them before, I'm cleaning it up today. And then they come back in here in 4 hours and say it's done. Okay? And then you have the other ones that try to circumvent the rules. So it might be in such disarray that there's not enough time to put there's not enough room in the paper that says miscellaneous items. But it should be associated with a picture. And the blight bylaw is on the web and everything like this. And it's a shame when you see some of these items, like stuffed couches and chairs and even stuff like this. We just had, 12 families go homeless?
Yeah.
Somebody doesn't need a chair. Somebody doesn't need a couch. You put it outside the elements.
Yeah.
Now it's trash. I hate to tell you. You know,
Baby seat.
But- first step, I would ask if you check with Rich to see if they've already got it and where it sits. And then that will lower your blood pressure a little bit. What's already seen. Yes. At least you can give the information.
The other thing I wanted to talk about for cleaning house, considering we're at 2024 is done for year end. I've been sitting on this committee for 2 years, sit on different committees for the last 12 to 13 years, and we've always received figures and data. What I am looking for is I would like to get numbers as far as like Dan, when you go out, how many food inspections are you doing? How many citations are going out? How many 21Ds you're issuing? How many appeals are going on? What's happening with that? Like, little Dan goes out and, how many septic systems is he inspecting? How many of his septic systems people are coming for the variances?
Mhm.
How many 21Ds? How many, I know a lot of people now, this year in 24, we've been having problems because of I believe it was 2 companies came in and bought a lot of property units and having problems. How many complaints are tenants does he, how many is he responding to from maybe a tenant complaining about, I got no heat in the house and the landlord's not fixing it. I'm trying to get numbers.
For what purpose?
For us, for our numbers, for us to see what's going on and how things are being done when the fire department puts them out, the police department puts them out, highway department, I'm looking for that, for a year-end report.
A year old,
A year-end. And then I would also like to see if we can get it monthly, a monthly report as far as, how we're progressing instead of trying at the end of the year, take all that in at once where we can, each month when we meet, just, hey, this many were done, and we issued, 110 21 Ds. That's what I was kind of.
I do have some reservations with that. That's my job to receive that data. And to ensure that the field team is doing that. I could agree with you for a yearly report, coupled with like the yearly town report, but on a monthly basis, that is, in my opinion, my responsibility. And that's where I stress what purpose, what logic do you see having that information?
Public record.
It is public record, but yet we don't compile that on a monthly basis, so we would have to institute something like that. That would be done on a yearly basis, but we do not have the instruments right now to have that data supplied to the Board of Health on a monthly basis. That is something that we would have to construct, some software and some other implementation of items, whether mostly electronic, to your system and compile it.
Alright, so then can we get by our February meeting, a year-end report? I'm also gonna reach out to Marissa, since she's on vacation, I'll email her next week to see as far as how the solid waste end is, and with that being, we're approaching that 1 year into it, and I'm sure we're gonna have to make some sort of adjustments here and there, because it's all new to everybody, but at least we'll have some stuff to go by.
Besides, I
And I know on that caveat, and I understand what Kevin was saying, maybe the monthly would have taken the place of the yearly. But I also understand that if the database doesn't allow that. But in the past, when I was on the board before and everything else, we used to get a yearly review from the health agent.
A yearly, yes, because again, we provide a yearly report for the town.
Correct.
And that would be very similar in the data. We compile all that.
And then that is something that, if there's trends, if things like that, it opens the door. Do we have to look at tweaking regulations? Do we have to, which is this board's thing, to help you and your group do their job?
And that's where it's kind of
And that's-
we have to adjust things.
That's what when he brought this to me, I know we used to in the past, because I was on way back. We used to get yearly reports. But that
I used to,
coincided with the
sit on
town.
all the different
Yeah.
committees and all that.
I think the model would be, the model approach, in my opinion, it would be to have it very similar as the yearly report. That is useful data and that extract that data and utilize that data for that effort, whether there needs to be amendments done with policy, regulations, etc. Yes, I think that we can provide that. But I would just stress at this point, at a monthly basis, we cannot.
That's it.
You done?
Yeah.
Okay, I only have one thing to relate to the board. I came in and talked to Mr. Fuentes last week. We had a situation that came up
What's that?
because on the Public Health Emergency Preparedness Committee,
Uh-huh.
you all voted me as the point of contact or the representative.
Yeah.
I've got a lot of personal issues going on. And there is the national conference.
Yeah.
Is it San Antonio?
Yes.
Texas?
Yes.
Sweet, I'm going.
And
Yeah.
the committee, and I don't even know if you can go, because the committee has a certain amount of money available for a certain amount of people.
Then you and I go.
And I can't go with my personal things going on at home. And I came and sat with him because he's been going to all these meetings. And I do not want to see if the grant money, even though some people can say it comes out of our pocket, I don't care. It doesn't impact the budget and bring the damn money back to town. I told him as long as he is prepared to, in other words, I appointed him and I sent the board that he is an alternate representative of this board in my absence. Because if I didn't have my wife and my mother at home, I'd be going in a heartbeat.
When is it?
I am not even sure. They're just getting into preliminary plans.
No, I'll go.
Yeah, pay your own way.
Field trip.
Nothing is in stone, but they can't even entertain anybody's anybody's interested in going unless they've been appointed by the chair as a representative.
Okay, if it's-
Let me get my crying towel. I just figured everybody else is working, it might be a thing, and this is a short notice, because they had to have a notice of.
I'm not sure. So when is this?
I'm not even
I didn't even
sure.
pick the date, it's
I don't
this
even
early
know.
in the stages.
It's early in the stages that the last meeting of December that I could not make because I had to take my wife for chemo. They sent a list around anybody who's interested in going. He's been sitting in on the meetings, this one in December happened to be face to face. And he put his name in. But we had to talk because I was unaware of that, and he didn't let me know. And all I strenuously set out there is it's a two-way communication street.
Oh, totally.
And I also got kind of taken by surprise at the January meeting because it was brought up during the meeting also that he put his name in, but we can't entertain it unless we get an email from you saying that you authorize him as an alternate.
Sure.
So I had a little sit down because he is also, correct me if I'm wrong, your point on emergency preparedness for the health board. So working in conjunction with this, he's doing his thing. We had a very good talk. I'm gonna be touching base with fire department on where the trailer sits for our shelter trailer, because that went off for some repairs. Working together with this to get some supplies and working together with both person who gets paid to do it and in the restaurants. So I just want to let you know that in my absence, he will be acting on that committee to represent this Board of Health, but I told him I want to know.
So can we actually have him come and report to us about what
That's-
he's doing, what he's learning, what this,
This is what I,
so we have some idea what we're actually doing?
this is what I discussed because, I got it somewhere. In this pile of garbage. Hello. We get the agenda and in the minutes. So I got the minutes, but it was just before the meeting of the past. So I did attend January 2nd meeting, it was virtual. They reviewed minutes. They, by the way, they got their new budget approved. The numbers I don't have yet. There was a lot, this was like a 20-minute meeting. It was even shorter than our last meeting. So this is why I want to sit with the chair, who's a very good friend of mine, and get some of this information. Because something came out on the EATS, they call it, request for supplies. Well, I know when I used to do emergency management over there, the state had a list of supplies that qualified. There was no guessing, there was no putting it on it and get denied. Here it is. I haven't seen that. There is also on deliveries and work plan, training needs assessment. So under that training needs assessment, is that only going to be for committee members, or can we use that for that? Do we have money for training needs, like coming out for what you did, what you're putting together for the choking and stuff like that?
Yeah.
Right, okay, that makes sense.
Okay, so it was a lot of updates. And they plan on having a annual drill, and this is, most of these drills are all online on March 3rd. And they have a meeting once a month, usually via Teams. So that one I attended.
Would the rest of us be able to attend first?
The drill is basically from what I understand, the drill is basically a contact drill. Those that have rights to get on WebEOC, go on, sign up, yes, click this, done.
And I know what you're talking about because I'm for the
It's
Salvation.
not a
Army.
full-scale drill.
Yeah, the like the emergency person for like this for Southbridge with the Salvation Army. And so we got that, it takes 2 seconds actually.
It's the same
Yeah,
concept, and
so,
like he
I mean,
had just,
I could send you an invite, but it'd be useless, cause all literally we do is just like say, I'm responding.
I think that's the kind of drill he was talking about, is actually actively.
yeah, no, it's not a hands-on,
No.
full-scale
No.
drill, it's not even a tabletop.
Yeah.
And I know he showed me that he got kind of sidelined last minute by the emergency preparedness guy over there for the relocation plan. And he had to update that, so we discussed about some things, and by the way, unbeknownst to us is that if this place went down, the headquarters for the Board of Health would be the DPW.
Okay, that's good.
Yes.
Sure.
And that was in the plan because TJ worked for him, and we spoke about it, and he thought TJ CC'd me, TJ thought he. So sometimes these little quick fixes. And like I spoke to him, and it was very, very good. He did not have Ritz on it. And like I told him, it's a very important thing because during the tornado, we had Casella come through because of the trash and the rotten food, because they were weak every day. You know what? You and Dan are taking care of working with the health issues on which I helped the inspector back then on damaged houses.
Yeah.
They're doing other things. Rich, we need Casella. Let us know what time we'll tell the people. Done. You have that.
Yeah.
Get it off my plate.
Divine.
Exactly. So we just added that tweak, and I don't think Teddy needs to be on it because that was strictly the Board of Health.
Is there any plan to do an emergency drill of some sort that we would involve in, say, this year? Or next 6 months or so?
I do not know how often we have to have a full-scale drill. I know the last one we were planning. We were planning, what did he call it? The zombie apocalypse. What we were planning is, in case we had a breakdown where we had to give medication.
We had conducted one last year, my first year here.
I think it was like 2 years ago. At
Yes,
Halloween, and you guys passing out like M&M's.
that was it, no, but it was at the community center. It was a mock drill,
Yeah.
Okay,
for the dispensing site purpose. Yes.
okay, that was one, and then we had one years ago, but that was prompted by the state.
Yeah. I think
We had to get the stuff out of the basement.
Okay.
And at that time, I don't even think this how long it was. We didn't do it at the community center. We set up at the old high school in the gym.
that was on.
So maybe time is coming, right? So be ready.
That one was cued by the state DPH because that was part of their thing to come and help us on that type of stuff. But I don't know what we needed. We always tried to plan. A, we tried to plan those drills in the nice weather, and B, when schools are closed.
Yeah.
So if we wanted to do something at the school or not, it doesn't happen. But I know one plan we had, it was a drive-through, and what we were gonna do is use the DPW. People would come through, and they were gonna register their dogs, their animals. And we had it set up with, it escapes me, the group, to give the inoculations, the rabies shot and stuff. And then,
Yes.
yes,
Yes.
and then COVID hit. And that all went, it's COVID. But we did have plans somewhere, and it was all laid out on the drive-through.
Yeah, I remember seeing that.
And Maddie was even gonna set up the IT stuff in the office if people didn't have their animal registered. Okay, pull up over here, go in there, get them registered, and what, Last Chance or whoever was gonna do it, was gonna give them their shots, their rabies, their annual rabies clinic. And it would have served both purposes. Dog officer wouldn't have to have a separate rabies clinic. It was all done in one, and then the community drill was done at the same time.
So maybe we should reschedule that and try to do it again. I remember, obviously never happened, so.
That takes some planning and organization.
Oh, it does.
But let's see, we got, because if I'm not mistaken, we also got a grant that we had a gentleman from the Cape. He came down and he was the proctor on this. He was the hired professional on doing all the paperwork. We had multiple meetings. He took care of everything to pacify the state as far as paperwork and all this other stuff, and the JPRs and stuff that we needed to comply to get credit for it. We hired a professional to do that. No, because there was only, this was not a meeting for everybody.
Yeah.
You don't get any work done. So this was on police, fire. There was just the core people to get this, and then once we got the full package of what we needed for help and how to make it work, then we lost them down. We were getting ready to do that, and then we lost the group that was gonna do the shots. Because they had illnesses, they had this and that, they couldn't make it, and it just, then COVID hit, and it all went down the sewer drain. Like the whole rest of the world. But, that's all I gotta believe. Yeah. All right, discuss the next meeting date, Thursday, February 13th at 6 p.m. Okay. Motion adjourned?
Who seconded the next meeting?
No, we don't have to, that was an announcement. We just need the vote to adjourn.
Motion.
Second, right. Okay, meeting's adjourned at 7:41.